इस वीडियो में हम बात करेंगे एनाटॉमी ऑफ फीमेल बोनी pelvis and fetal skull. The bony pelvis. Which bone compose the bony pelvis? Ilium, ischium, pubis, sacrum and coccyx. सबसे पहले हम बात करते हैं कि pelvic brim क्या होता है. What is pelvic brim? It is the inlet of pelvis which divides the pelvic cavity into false and true pelvis. It is formed by the sacral promontory ala of the sacrum, accurate line of ilium, iliopubic eminence, pectineal line of pubis, pubic crest, symphysis pubis. The plane of the brim is 55 to 60 degree of horizontal. बाकी डायग्राम में आप डायग्राम देख लें, इसमें कुछ डिटेल्स वगैरह दी गई हैं जो कि आपके लिए बहुत ज़्यादा इम्पोर्टेंट है. तो आप ये डायग्राम अच्छी तरह देखें, आपके आगे पेपर्स में या एमसीक्यूज़ वगैरह में काम आ सकेगी. Bony pelvis. The brim is oval in shape, anteroposterior diameter. The pelvic cavity. The pelvic canal is curved. The post wall is longer than the anterior. The most roomy zone with almost round shape. या मेल और फीमेल की पेल्विक इनलेट आउटलेट कैविटी और आर्क का थोड़ा सा डिफरेंस बताया हुआ है. द बोनी पेल्विस. द पेल्विक आउटलेट lower border of the symphysis pubis, ischial tuberosities and tip of the coccyx. The subpubic arc has an angle of 85 degree. The obstructive outlet plane of the least pelvic dimension and mid pelvis. Diamond shaped APD lower border of symphysis pubis to last fixed point of sacrum between ischial spines. Typically, female pelvis found in 50% of women, rounded slight oval inlet, straight pelvic sidewall with roomy pelvic cavity and good sacral ischial spines. ये कुछ डायग्राम है जिसमें आपको पेल्विस दिखाया गया है. सैक्रोस्पाइनस लिगामेंट, sacrotuberous ligament, sacroiliac ligament, lumbar ligament. What is meant by clinical favorable pelvis? Sacral promontory cannot be felt. Ischial spine are not prominent. Subpubic arc except two fingers. Intertuberous diameter except four knuckles on pelvic exam. What is the obstructive conjugate? The shortest APD between sacral promontory and symphysis pubis can only be measured radiologically. What is the true conjugate? APD between promontories of sacrum and superior margin of the symphysis pubis. What is diagonal conjugate? Distance between sacral promontory and inferior margin of the symphysis pubis measured clinically. The skull is formed of face, the vault and the base. The bones that form the skull are two frontal bones, two parietal bones, two temporal bones, wing of the canine and occipital. A molding of the head occur with the descent of the fetal head into pelvis to reduce the head circumference. Frontal bone slip under parietal bones. Parietal bones override each other. Parietal bones slip under the occipital bone. Degree of modeling क्या होता है? Molding. Structure lines are separate. Suture lines meet. Suture lines overlap but can be reduced by a gentle digital pressure. Overlap irreducible.